Hi John, it's Dr Ingram here. How are you going?
Reasonable.
Are you happy if I call you John?
Yes.
Yeah.
Quite happy.
And how old are you, John, just for my records?
98.
Yeah, okay. And I'm just going to talk to you a little bit about why you came to hospital this time. So what was the symptom that brought you in this time?
I thought my foot, which no blood was getting down into it apparently. I thought it was starting to come good, and on Thursday night, the next morning, it was starting to bit of swelling and a bit of soreness.
Okay.
I thought I'd better get in, have something done about it.
Okay.
So I rang, my friend, next door neighbour, they rang the ambulance and got me in here.
Yep. And which foot was that? Which side?
The left foot.
Okay, so the left foot.
So I've had a ulcer on my big toe for about 3-4 years now.
Yep.
And it just won't heal because no blood was getting down to it.
Okay. So, and just tell me about that pain. Are you getting it all the time, or is it in certain situations?
Oh no, it's a pain it's bearable, but occasionally it gets a little bit more so than bearable.
And which part of your foot is it in?
Big toe back round about the heel.
Okay.
And that's about the extent of it.
Okay.
But there's definitely no blood getting down into it.
And what sort of pain was it?
And about 3 to 4.
Yeah.
Just uncomfortable.
Yep. Sharp, burning.
Oh no, just a burning, continual pain.
And is there anything you could do to make it better?
Oh, exercise and try and get the blood down into it, but wasn't getting past. Had to have another stent later on.
Anything that made the pain worse?
Hitting it.
Okay, something sensitive to touch.
Yeah, sensitive.
Okay. Yeah. And did you get the pain in day and night?
Any time. Worrying me. Sometimes at night time my leg would get agitated.
Okay.
And it just worried me. Previously I had a needle in the back while I was in Hollywood. They said Dr Nash or something like that.
Yep.
She said sometimes this helps because I'd lay there and I just couldn't stop moving my legs.
Okay. So if you had that pain in bed and you swung your leg over the edge of the bed and put it down, was that helpful?
Well, I never ever. I was always laying down when it happened, and I never ever suggested doing it. And they finished up giving me some little pill to take to get rid of the agitation.
And do you remember what that injection was called? Was it a sympathectomy? Is that what they called it?
I wouldn't have a clue.
Or did they inject local anaesthetic in?
No, I wouldn't have a clue what it was.
Okay, no, that's fine. And how far can you walk at the moment, John?
Well, at present I'm not doing anything, but last time I was in Hollywood, I was doing a lap around that ward, which would be around about 50 metres.
And when you're at home, you could do 50 metres?
Well, I can't because I'm on a very busy road.
Okay.
Duke Street in Scarborough.
You're a bit limited.
And to try and get across the road, I'd have to pull the traffic up.
If you walk, do you get any pains in the backs of your calves or in the backs of your thighs?
No.
Okay. And you were saying you know that your blood supply is not good to your legs.
It wasn't until I came in here this time.
And what have they done tests to work out that it's not so good?
Well, they've given me put in a new stent
Yep.
I had a stent earlier by Dr Bray,
All right.
and apparently wasn't doing too good.
Yep.
And this
Just
time
hand
in
over
here,
first, and then we'll sort that out.
last week sometime they had me down for about a couple of hours and in the room. And
Yep.
I think the blood is flowing down there now.
Do you think you had an angiogram and an angioplasty? Does that word sound familiar?
Possibly.
And they put a stent in, did they?
Yeah.
Okay.
Put
And
another stent in.
how's that pain going since you had the stent put in?
Well, I haven't had to worry about it.
Oh,
since.
great.
Yeah.
Okay, so that pain's better. That's good news. All right. And in the past, have you had any operations for blood supply to your legs?
No, I unfortunately
So if it's
went back
secondary, it
to,
should be done today.
I had 20 odd years, or 20 more years ago, a Dr Ingram.
Yep.
He replaced the knee, and it was great for about 20 odd years. I started to play up and I went back and had a Dr Khan. And because I went to a special, somebody that does the massaging
All right.
locally,
Yes.
found out I'd done that, and he just says I don't want to see you anymore, and just left me.
Okay. So getting back to just the circulation, have you ever had a bypass graft before, or any other sort of operation to improve the circulation?
No,
No. Okay. Good. So you've just had 2 stent angiograms and stents. Yeah, good. All right. So I might just ask you a little bit about, what might be behind the causes for your blocked arteries. Have you smoked, John?
never spoke since my sister pipped on me when I was 10.
Okay, so not very much at all. Good. And do you have diabetes or blood pressure trouble?
I have diabetes, yeah.
Okay. How long have you had that for?
Well, when I had my bypass, that's when they found out. Told me. I never knew about it until then.
Okay. So we might explore the diabetes in a bit more detail later on.
Yeah.
So you've got, when you say heart bypass, you mean a heart bypass?
Yeah,
Okay, so you've
double
got some
bypass.
heart disease. Right. What about your blood pressure? Has that been high in the past?
Oh, not really. I take my insulin in the morning. I have a nurse calling in around about 8 o'clock and does my insulin in the tummy and also takes my blood count on the finger.
Okay, yep. All right. Any history on your family of these blocked arteries?
No.
All right. So we might just go on to talk about some of your other medical problems then. So you've already mentioned that you've had a knee replacement.
Yeah, knee replacement.
And you've had the diabetes.
Yeah, I had a hip replacement.
Okay. Which side is that?
That's I think Dr Ingram did that one too, but I'm not sure on that. Far too
Okay.
far back.
Okay. Yep. And did they say what was the cause of your hip problems? Was it osteoarthritis or?
Oh, I don't know what it was. Played a lot of sport
Sure.
in my younger life.
Oh yeah.
Yeah.
Okay. And the diabetes, how long have you had that for?
Since I had the
Yeah.
so
And
they-
how long
that's
was
when
the bypass, did you
they,
say?
yeah, then they found out what they told me. I never knew a thing about it until then.
Yeah. And how's that been treated? You're on insulin now, you've mentioned.
Yeah.
Have you had tablets in the past?
Well, what tablets I take in the morning, I don't know what for, but I take around about 10 or
It's a fair swag, isn't it?
yeah.
Okay. All right. And the insulin, which is with the nurses that you've mentioned. And how are your sugars going? Do they talk to you about
Well,
What the
while I
numbers
was,
are like?
for about the first, so long, I was giving myself so much before each meal. But then back in Hollywood, and they suggested that I have 28 or I think units each morning and see how I go at that.
Yep. Okay. And how's it been since you've been on that?
I've been pretty good.
Okay, good. Sometimes people have a blood test which is called your glycated hemoglobin. It's a result which indicates your diabetic control. Do you know what your number is for that?
I wouldn't have a clue.
No, okay. Have you ever had what they call hypos or hypoglycemic episodes where your sugar level goes too low?
I don't. A couple of times they've done that and they suggested I take dry biscuits and cheese.
Yep.
And a little bit of fluid to go with it.
Has that happened lately?
No, not lately.
Okay. And have you ever been to hospital with your sugars going too high?
No, never.
Yep. Sometimes people with diabetes get pins and needles in their legs and they can't feel their feet so well. Have you had problems like that?
No, never had that.
And what's your eyesight like?
Reasonable for my age. I was wearing glasses before I was diagnosed with this macular degeneration.
Oh, okay. Yep.
But I haven't been able to get to a specialist since.
Okay.
And
did they do any injections into your eye for that?
no, not for the macula.
Yeah.
I was having little black flies flying around in this eye, apparently.
Okay.
I've had needles in there and ointment.
Okay. Okay. Yep. And have doctors ever told you that your kidneys have been affected by diabetes or anything else?
My
Kidneys have been affected.
no,
No, your kidneys are working okay. Yep.
kidneys are working okay, apparently.
Good. Okay. Any other? So tell me about your heart. So you've had your bypass. Did that work for you?
Yeah, I've never had any trouble since.
So you don't get angina pains or chest pains? Okay, good news. And have they ever told you that you've had heart failure?
No.
No. How's your breathing? How's your breathing?
Breathing's all right. Never ever worried me.
Okay. Do you get swelling in the legs?
It,
Swelling in the legs.
no, not particularly.
No.
We'll just check his ulysses.
Can you lie flat in bed, or do you need to sleep a bit up?
I need to head up just a little. I normally sleep left or right hand side.
Okay. Yep. All right. Any other medical problems that we don't know about?
I don't think so.
That's a fair swag, isn't it? And do you know what your medications are? It sounds like you're on a lot.
I wouldn't have a clue what I take in the morning.
Okay, so I'll check your chart for that. So you're on insulin once a day.
Yeah.
And how are your medications organised when you're at home?
Just at present, the insulin, they give me a little jab of 1 or 2 during the day now in here.
Sure.
But at home, I'd have the 28 and then
Yep.
I'd go right through the,
28 minutes.
nobody'd take it and notice any after that until the next morning.
Sure.
That was always
Yep.
pretty good the next morning.
And your medications, how are they organised? Do you just take them out of the bottles or are they in a...
I have a Webster pack
Okay.
at home.
And can you see all right to pop them out on the right day?
Oh yes, they're in a full, that's one before brekkie, well before brekkie. That's in not larynx, something similar to only a little tiny piece.
Okay.
Then I have 10 with me, with my breakfast.
Yeah.
But just what they're for, I wouldn't have a clue.
Okay. Do you remember to take them regularly?
Well, I've got the Webster pack there, and
Yep.
they're just got to press them out of the Webster pack and take them with me. I have wheat bix and milk, and I just take it with the milk before I have my wheat bix.
Yeah, good on you. And any allergies to any medications?
No,
And any other diseases that run in your family that we need to know about?
not that I know of. I don't think I've ever any of the other family, only mum and
Yes.
father, they were separated early.
Does diabetes run in your family?
I have an auntie that I knew had diabetes,
Okay.
and I've got an idea my grandmother on mum's side
Okay.
had diabetes too.
Yep. Okay. Okay. And what about heart problems?
Hmm?
What about heart problems?
I wouldn't have a clue about any
Okay.
heart problems in the family.
All right. So, John, can we just talk a little bit about where you live? So, do you live by yourself?
That was my aim, to live by myself until the time comes along.
Yeah.
But it's getting to the stage now where I think I need a bit of attention.
Right.
So, like my son's in Mandurah.
Yeah.
I'm in Perth.
Right.
Consequently, you can't get back.
Yeah. Yeah.
And so I'm off to Meadow Springs, I believe, into a home down there.
Right. Okay.
And hopefully it all works out okay.
Yeah. Yeah. Was your house big?
The house will be rented.
Yeah.
If I sell it, I lose my pension. I've got too much money.
Yeah.
And so the son's idea is to rent it out and see how things go.
Yeah. And how do you feel about the idea of moving to a nursing home?
Oh, it's got to be done.
Okay. So you,
It's getting a bit too much, and I'm relying on my next door neighbours, who's one of the girl or the lady on my next door neighbour.
Yeah.
She is in hospital at present
right.
in Hollywood,
Yeah.
having treatment for panic attacks.
It's a tough decision to have to make to go into a nursing home, isn't it?
Yeah.
Yeah.
Yeah, I just didn't want to. I
Yeah.
wanted to finish up
Yeah.
in my own home. But
Yeah.
looks as though it's not
So
possible.
what can you do for your at the moment? What can you do for yourself? Are you able to get up out of that chair and walk by yourself?
Oh yes, I can do that.
Okay. And what about tasks such as showering and getting dressed?
Shower, I can do it by myself.
Yeah.
Need a little bit of help in drying my back and things like that.
Yeah.
Um,
And what about the bladder and bowels? Do they work okay?
Bladder, yeah, they're sometimes I just manage to get there, and a couple of times I've missed out.
Okay. All right. And how are you feeling in your spirits with all of this happening?
Well, at present I couldn't care less what happens.
Yeah.
It's I've had a full life.
Yeah.
I've played cricket, football, umpired football, played tennis, played golf.
Wow. Good sportsman. Yeah.
At 90 I had to give golf away, even though I was getting around on the bakkie,
Yeah.
but I had to give it away.
Okay. Would you say have you been feeling down in the dumps recently?
Oh no, I feel a little bit distressed, I should imagine, but not that I notice it within myself.
Yeah. You're still capable of feeling happy.
Oh
If-
yes,
You have visitors or something's
well, I
happening.
don't have many visitors.
What about in here? If your son visits in here,
Oh, it's being in Mandurah doesn't come up very often.
Yeah. Okay.
Anyway, if I want something from home or
Yeah.
so,
Yeah.
consequently, I'd see a lot more of them if I
Yeah.
moved down to Mandurah.
Yeah. Yeah.
To Meadow Springs.
And John, do you? We've talked about you don't smoke, but what about alcohol? Were you drinking much alcohol at home?
And I gave that away when they told me I had diabetes.
Yeah. Okay.
That was at 65.
Yeah. All right. So we're just about finished taking the history, but I just want to ask you a couple of things that we haven't crossed yet. Have you had any falls in the last year?
Oh, not the last year. Previous to that, I had 2 going out of the toilet because I had 2 steps, one out of the kitchen onto another area. And then I had only a small area. I had to step down again into the laundry and then turn back around and get into the toilet.
Okay.
And the toilet had no rails,
Right.
asbestos lining, and they wouldn't put any rails in.
Okay.
It's been a couple of times coming out of there. I had to reach around to get to the rail, and my son put a rail in.
Okay.
It's him.
Yeah. And what about in your, sorry to interrupt you, what about your memory? Do you think your memory is as good as it was 5 or 10 years ago?
Oh, I can remember back to my boyhood.
Yeah. And what about your short-term memory? So remembering things that happened this morning?
Well, I'm very bad on names.
Yeah. That can be a normal part of ageing.
Yes.
I suspect your memory is not too bad, John.
Nurses are easier way to...
Yep. Okay. So I think we've talked about sort of heart symptoms, and you've said you're not too short of breath. Any cough?
At one stage I had a bit of a lung infection.
Yep.
And I think the first time I coughed it, they drilled into my back while I was talking to somebody else and drained it out through that way.
Okay. Yep.
But since then I had it again, and they simply coughed it all up.
Okay. Has your cough settled down now?
Yeah.
Okay. And you said your bowels are okay. Do you get any indigestion?
Bowels are okay as long as I keep taking Movacol.
Movacol, okay.
No.
Any indigestion?
No.
No. Okay. Any other problems that bother you?
Oh, just that I can remember straight off.
Okay. Well, we're going to examine you now, but I think
sleeping is a little bit of a problem.
Is it?
Yeah.
You struggle to sleep, do you?
Well, they won't give me a diazepam, I think is the word. Only every second night. Some nights I lay awake for an awful long time.
Do you? Yeah, okay. Maybe we can talk about that.
Yeah.
All right. All right, we'll leave it at that for the moment, John. Yeah.
Thank you.
Yeah, thank you very much. So I've previously examined John, and I've got the examination findings. As you could see, he's a cooperative, cognitively intact elderly gentleman whom there was evidence of a four-wheel walker at the side of his bed. There's also evidence of finger pricks from his glucometer readings, and his current glucometer reading is 9 millimoles. I examined his peripheral vascular system first. He's got evidence of the left puncture wound in his groin from his recent angiogram. This is not swollen though, and I can palpate a femoral artery on both sides. I can palpate a popliteal artery on both sides, but he's missing pedal pulses on both sides. On examination of that left foot, both his feet are cool, with the left foot slightly cooler than the right. They've both got a purplish discoloration to it. He's got a ulcer on his first toe, which is a little bit tender, but there's no evidence of cellulitis surrounding it. He has reasonably good capillary return in both feet now. On cardiovascular examination, his heart rate is 74, he's in sinus rhythm, and his blood pressure is 145 on 70. He does have a carotid bruit audible on his left carotid artery, and on auscultation of his heart, he's got an ejection systolic murmur. There was no evidence of cardiac failure, no peripheral edema, and examination of his chest and abdomen were normal. On examination of his neurological system, he just had some mild proximal weakness of his hip flexors bilaterally, consistent with deconditioning from being in hospital. Thanks.
Perfect.